Hello student, let us try to understand the analogics. You know, so what are analogics, student? If you talk about analogics, there are also the neuroactive drugs are there, student. These are neurologically active drugs which reduce or abolish pain without causing impairment or consciousness, mental confusion, incoordination, or the paralysis or some other disturbance of the nerve system. So, what the point they are saying, student, if you talk about this, the point they are saying, student, that is they are the neurologically active drugs which reduce or abolish pain without the causing impairment of consciousness, like that mental confusions, incoordinations or paralysis or some other disturbance of the nerve system. These are two types of the analogics are there. First one is non-narcotic analogics and dusra is not, the second one is narcotic analogics. Okay, so if you talk about non-narcotic analogics, student, these are simple to use. Non-narcotic analogics are used to relieve the mild pain like headache, backache, etc. These are non-additive and generally do not produce toxic effect. Okay, so they do not addictive is whatever non-narcotic analogics are there. They have the no, they do not produce the toxic effect, student. Like aspirin is there, paracetamol are the important example to the class of non-narcotic analogics. Okay, student. Aspirin inhibit the synthesis of the chemical known as the prostaglandins, which stimulate the inflammation in the tissue and causes pain. Aspirin inhibits the synthesis of the chemicals known as prostaglandins, which stimulate the inflammation in the tissue, causes pain. So we are using the aspirin. Aspirin should not be taken on empty stomach. That is the first point. Whenever you are taking the aspirin, we must avoid to take in empty stomach, student. When you talk about the another point, student, for the non-analogics drugs, student, or narcotic analogics, they are saying if it is taken empty stomach causes blood bleeding in stomach and may cause the ulcers also. These drugs also act as antipyretics, reduce the fever, relieve or reduce the skeletal pain due to the arthritis, and prevents the blood platelets coagulation. Okay, aspirin, due to its anti-blood clotting action, it is the widely used to prevent the heart attack, even though it is the toxic to liver and sometimes causes the bleeding from the stomachs. What the point is all about, student, you can read out that they are saying aspirin is due to its anti-blood clotting action. It is widely used to prevent the heart attack, even though it is the toxic to liver and sometimes causes the bleeding from the stomach. Due to its aspirin toxic nature, other analogics like that naproxen, ibuprofen, diclofenac, sodium or potassium are currently being used. So, dear student, due to the toxic nature of aspirin, it is being replaced by some other medicine like that naproxen, ibuprofen, diclofenac, diclofenac, sodium or potassium are currently used. Compound of the salicylic acid like that aniline, phenol, parazole, quinoline, etc. are used for as a narcotics drug. Some of these act as an anti-inflammatory and antipyretic also. Now preparation of aspirin. So there is the salicylic acid is there which is being treated with the acetic anhydride. So it is giving the aspirin. Aspirin is known as acetyl salicylic acid. IPAC name of aspirin is 2-acetoxy benzoic acid. Okay. Now next class is that narcotic drugs that we will be able to read out in the let us see is, if you are talking about non-narcotic analgesics, student, are the alkaloids. Okay, narcotics analgesics relieve the pain most effectively, but these are addictive and induce sleep. So these are narcotics, are whatever the narcotics are, they are very much addictive, student. When you are taking this and narcotic drugs, you will become used to, okay, it produce the sleep. These are used to reduce the severe pain like the post operative pain, terminal cancers, cardiac pain, and childbirth. When these are taken in the high doses, they produce the toxic effect like the stupor, coma, convulsion, and sometimes even leads to death also. Morphine is there, heroin is there, morphine, diacetate, and codeine is there are the important narcotic, analgesics. Morphine and many of its homologs are administered in the medical doses, relieve pain and produce sleep. In poisonous doses, these produce stupor, coma, convulsion, and ultimately this. Morphine is there, heroin is there, and codeine is there. This is. Now, student, if you talk about the morphine, so morphine control the diarrhea, cough, etc. Morphine and its related drugs not only control pain but also they modify emotional reaction to the pain. When one of the phenolic group is morphine is methylated, it's convert into the codeine. Analgesics action of the codeine is lesser than the morphine. So analgesics action of codeine is the lesser than the morphine, that we have to keep in mind. Okay, in the next video we will try to study the antipyretic drugs, student. Thank you so much for watching. This all about we study the student analgesics. And analgesics, I told you that it is the it is also the neurologically active drugs, student. And these are of two type: non-narcotic analgesics and narcotic. Non-narcotic is there, that much of not dangerous, student, but a narcotic does is this is the addictive. Okay, so it always produce the sleep, and it's become the if person is taking narcotic analgesics, he will become the used to taking it. Thank you so much for watching, friends.